Hi, welcome to Daily Pathology. So this is very important yet most confusing topic which will you face in your peripheral blood smear examination. That is how to identify the blast as well as how to differentiate these true blasts from its mimickers. What are the various mimickers in the peripheral blood smear examination that mimic the blast? So this topic help you to identify true leukemic blast, exposing the benign mimickers and avoiding the diagnostic errors which are most frequently done by everyone. So let's begin. First is the size trap. Not every large blue cell you seen in the peripheral blood smear is the blast. It is the least reliable indicator of malignancy on peripheral blood smear. If you are thinking that if the cell is of large size and you are saying that it is a blast, this is wrong. Here you can see in the image he showing a true blast is of 12 micrometer size, and here is the large cell, but it is not the blast. It is reactive lymphocyte of 25 micrometer. So diagnostic pearl here is never rely on size alone. Some small cells are true leukemic blast, while many giant atypical cells are benign reactive mimickers. Next, anatomy of true blast. How to identify the true blast on peripheral blood smear. First is high NC ratio, that is nucleocytoplasmic ratio. You can see in the image the cell is having a large nucleus and there is a scant cytoplasm in the periphery. So nucleus size is large and compared to that the cytoplasm is very small. So it is having a high nucleocytoplasmic ratio. Next is fine delicate chromatin. So you can see here this is the fine delicate chromatin which is smooth and not the clump chromatin, like these, not like this clumping of chromatin is not present. So if the chromatin is open you can easily see the nucleoli. So next is prominent nucleoli. So in various type of blast you can see various types of nuclei, like in lymphoblast you can see 1 to 2 nucleoli, and in myeloblast you can see 2 to 5 nucleoli. So depending on the type of the blast, this nuclei is a distinct round space visible within the active chromatin. So these are the nucleoli. Next is scant deeply basophilic cytoplasm at the periphery. Here you can see this is the scant deeply basophilic cytoplasm, which is an important feature. And next are OR rods. These are the OR rods. If OR rod is present, then you can call it as a myeloid blast until proven otherwise. So this is the identifying feature for the true blast. Remember these points, these are very important. Next is decoding NC ratio. If some cell is having a high NC ratio, then you can say it as a blast, and if some cell having a low NC ratio, normal or a mature cell, you can say, but this is not always the case. High NC ratio, nucleus is actively expanding and consume entire cellular space. And next is chromatin structure. Fine or lacy chromatin is mostly seen in the blast cell, whereas clumped and clock face chromatin are seen in the mimickers of the blast. Remember this point. So fine chromatin means active unpacked DNA ready for the transcription, and clumped chromatin, here you can see this is the clumped chromatin, and which means the cell is mature and resting. Next is subtyping of the blast. So what are the various blasts you can see on peripheral smear, which include myeloblast, lymphoblast, monoblast, erythroblast and megakaryoblast. So these are the some important clues for you guys to identify this cell. So on morphology, myeloblast having a fine chromatin and 2 to 5 nucleoli, as we discussed earlier. Pathognomic clue is OR rods, but it is not always the case. Mostly can see in APML. Then biomarker is MPO positive, that is myeloperoxidase positive. Next is lymphoblast, which is a small to medium cell and having inconspicuous nuclei or 1 to 2 nucleoli, scant cytoplasm and no granules, and it is TDT positive. Next is monoblast, abundant basophilic cytoplasm and prominent nucleoli and morphology you can see. Then irregular nucleus or folded nucleus is the clue. Remember this point for monoblast. Here you can see this is a irregular folded nucleus, you can see in the image, which is NAC positive. Next is erythroblast, deeply basophilic cytoplasm, round nucleus, and it has also no granules and glycophorin A positive. Next is Megakaryoblast, which is having a fine chromatin, you can see in the image, and very important clue is the cytoplasmic bleb. Here you can see these are the blebs, cytoplasmic blebs or extensions, which is a important clue. Then what is the biomarker? That is CD41 or CD61 positive. So this is the clues for you guys to identify these various blast. There are more, but these are short. So let's see what are the mimicker traps that will confuse you that it is a blast or not a blast. So pathology is filled with visual doppelgangers. These are the doppelgangers, which these 5 entities most common mimickers that will false positive blast identification on peripheral smear. And to find the true blast, you must know these mimicker first. So most common is the reactive lymphocyte, then monocyte, prolymphocyte, plasma cell, and immunoblast. We will see one by one. The viral lookalike. So this is between the true blast and the reactive lymphocyte. How to differentiate between these two? So deceptive feature is both are large cell and exhibiting deeply blue basophilic cytoplasm. Here you can see both are showing deep basophilic cytoplasm. So what is the unmasking feature that showing reactive lymphocyte is cytoplasm hug or skirts around the RBC. Here you can see this is how the reactive lymphocyte present in the PS. Then chromatin is coarse and clumped. Here you can see this is a coarse chromatin, and here you can see this is fine chromatin. More abundant cytoplasm overall, so there is a low NC ratio. In blast there is high NC ratio, you can, as we say earlier. And cell, as I say, irregular or flowing borders, very important for identifying the reactive lymphocytes. So this is how you differentiate between reactive lymphocyte and true blast. Next is the chromatin trap. So the mimicker is monocyte. The deceptive feature is monocyte possess naturally lacy immature looking chromatin. Here you can see this is a immature looking chromatin or lacy chromatin, which will confuse you thinking it as a blast, but no, that easily masquerade as a blast. Unmasking feature is monocyte show folded, indented, or kidney bean shaped nucleus, but that is not always the case. Then abundant gray blue ground glass textured cytoplasm. Here you can see ground glass cytoplasm. Cytoplasmic vacuoles are frequently present. So these are the few clues that you will remember for the identification of monocyte, which will mimic the true blast sometimes. Next is geometry anomaly, that is plasma cell and the true blast. So deceptive feature is both having intensely deep basophilic cytoplasm, that is dark blue cytoplasm, mimicking a highly active blast. So here you can see it has a deep basophilic cytoplasm. So unmasking features, so it's eccentric nucleus. The nucleus of plasma cell is away from the center, so one clue. The next is perinuclear half. Here you can see this is the ring of clearing around the nucleus, that is perinuclear half, which is present in the plasma cell. Coarse blocky clock face chromatin arrangement. Here you can see this is the coarse clock face chromatin or cartwheel chromatin, as you can see, is present in the plasma cell. Next is the nucleoli dilemma, which can be confused between immunoblast as well as prolymphocyte, as both can show prominent nucleoli. So how will you differentiate between two? So in case of immunoblast, you have to find out, is there any viral infection or is there any infection that leads to patient immune activation. And clue is immunoblast is a large cell abundant basophilic cytoplasm, and it has an open chromatin. In case of prolymphocyte, there will be context of chronic chronic lymphoproliferative state, and the clue is it is a medium or small cell, moderately condensed chromatin, and moderately pale cytoplasm. In case of lymphocyte, it is a deeply basophilic cytoplasm, but here the cytoplasm is more paler than the deeply basophilic. Next is the very important in pediatric patients, the hematogones. Here you can see the hematogones. What are hematogones? These are normal B lymphocyte precursor, which can very easily confuse with the lymphoblast on morphology. So it is very difficult to identify these hematogones from the lymphoblast only on morphology. So you would need a flow cytometry for this. Why the hematogones are confusing? Because these cells having a high NC ratio as like blast, perfectly round nucleus, fine chromatin, and prominent nucleoli. So these are also a features of blast. So that's why these are most mimicking towards the lymphoblast. So in case of flow cytometry, to confirm the normal B cell maturation phenotype, you will need CD10 positive, CD19 positive, and CD34 variable. So this is the cheat sheet which we discussed earlier. In short, you should take a screenshot of this and remember this. This will help you to differentiate mimickers from the blast. Very important. Last but not least is the diagnostic triad. Accurate blast identification is only the first step and not the definitive diagnosis. We never made the definitive diagnosis only on peripheral smear examination. Always correlate with the clinical history, that is patient age, history of the patient, presenting symptoms, and full CBC data. Then morphology, of course, important. High NC ratio, chromatic texture, nucleoli, cytoplasm, or rod present or not. So this is very important. And lastly, the ancillary test. These are bone marrow biopsy, flow cytometry, cytogenetics, and molecular studies. These are very important. So together all this diagnostic triad will help you diagnose the leukemia or lymphoma. Thank you.